I think my main focus is on seeing the patient as full and competent and having the answers and the resources he or she needs. If I can manage to hold that perspective, I allow the patient to own their own life and to be subject in their own life and not just an object of my treatment. I think that the model of using biopsychosocial attitude in treatment is gaining weight. So there is an increased interest in how do we give patients back their life. And there are studies now showing that patients actually become better if they are given back responsibility for their life. So there is a movement in that direction. And I think it is reflection on our society which takes more and more away from the person. More and more is decided by the state or by companies or by your employer, and you have less and less influence. So I think there is a reaction to that, and we see that in medicine as well. I think that it's because I have been interested in the Eastern way of looking at the human being for many, many years. And I've always felt that a circular understanding of the human condition is more logical. That everything is contained within one whole. And in that whole, everything is dependent on each other. And to me, that's much more logical than to think that something is a start and a finish, like the creation and the end of creation. To me, that is not logical. So through that interest, I've become sort of increasingly interested in the holistic perspective. To thinking holistically is being acquainted with my own intuition, trying to trust and express what I feel when I meet patients. Not to be afraid to show myself. And when I can do that, something else happens. So I think my main tool is trying to get acquainted with myself and to not to make a distinction between what I do and who I am, so that I do what I am. I would consider to use any tool as long as it does not cause harm or damage the patient. So if the patient comes to me and says, I know this person, he's treated some of my friends, he used this special technique, what do you think about this? And if I then don't know, I say I don't know, but if there are people that get benefit from that treatment and you can see no harm in trying it, I don't object to that. So I have no limit as to say this is holistic instruments and that is not. I think the main reason why they don't meet is fear. Because we all get attached to the way we look at reality. And so biomedicine is attached to the biological model. And when they meet another understanding, you have either you get curious and you open up, or you get fearful and you protect what you have. So I think the main obstacle is to get over that fear. And I think the way that I can work in that field is I have to be able to respect and give room for the other possibility. I have to respect and give room for biomedicine. And if I can do that and at the same time practice holistic medicine, I think that is the way to join them.